All right. Well, thank you guys. I am excited to be here, and thanks for Missouri Breaks for letting me talk today. So I am going to first just go through, I'm going to do some introductions, and then I'm going to share with you guys about what ECHO is, how ARI and ECHO partner with tribal communities, and then if we have time, I really want to hear from you guys on what matters for OST. If not during this presentation, I'd love to talk with you during the breaks to get your guys' feedback. So this is, I am Wey Hockett. I am a mother, a wife, a researcher, and community member. I am a PI or MPI of the ECHO study for South Dakota or the South Dakota sites. And then Dr. Amy Elliott is also MPI along with myself and was unfortunately unable to make this today. All right. So what is the ECHO program? So ECHO stands for Environmental Influences of Child Health Outcomes. And really the main objectives is to improve the health of children and adolescents. And we do this through two types of research programs. We have a longitudinal observational program, and we have a intervention arm as well. And this research is focused to inform high impact programs, policies, and practices at a national level. The Institute also, or the program, the ECHO program also uses has a very strong belief in team science. And you will see this kind of as we talk about how we bring tribal communities into ECHO, and just the ECHO community itself is very collaborative and focuses on team science and working collectively to improve child health. So really the overarching scientific goal of ECHO is to better understand the effects of a broad range of early environmental influences, which I'll talk a little bit about in a few minutes, on child health and development. So what does that mean? So there are, ECHO focuses on, so ECHO focuses on 5 pediatric high impact public health outcomes. So you're going to see this down below, right below the US map. The first little image is what we call pre, peri, post. So that's any kind of outcome, maternal or infant outcome that happens during or around pregnancy, so the first year or two of life. Then we have upper and lower airways, so that can be looking at asthma, bronchitis, infections, anything like that. We have obesity, so that's going to be obesity or any type of cardiometabolic outcome. We have neurodevelopment, so that can range from looking at autism to external or internalizing behaviors. And then we have positive health, so looking at child well-being and quality of life. And the reason why ECHO picked these outcomes is because these outcomes were seen as very high impact, again, at the community level, but also at the national level when we think about policies and practice. So ECHO is made up of 46 awards across the nation and 77 what we call cohort sites. And so this map up above, where you see kind of the red little dots, just gives you, you're not going to be able to see them probably exactly like where they are, but it just gives you a rough idea of where these ECHO sites and where this research is being done in the United States. And so you can see that there is a broad range of locations. And here in South Dakota, Avera Research Institute is the one, we conduct ECHO or enroll participants into ECHO across the state. And then the other image that you're going to see on the right-hand side, is called the participant journey map. So what ECHO does is we enroll pregnant women who are 20 weeks or less. We follow the moms during pregnancy, and then after pregnancy, we continue to follow the moms, but then we also follow the children and the partner, if interested, from birth till 21 years of age. And so currently, right now, we have over 3,500 mother-child dyads within our South Dakota cohort. And across the nation, we are looking to enroll 130,000 parent-child dyads within the ECHO cohort. Okay, so I know I am running up low on time. So I just wanted to give you a couple examples of scientific questions that ECHO asks. And these just kind of talk through or give kind of an example of the variety and the spread and the broadness of the research that is done in ECHO. So, you know, asthma is one of the most important chronic conditions in childhood, so better understanding where the disparities lie, when does asthma start, how can we prevent it, childhood obesity and the resistance to individual interventions, and so better using ECHO data to better understand how policy could provide potential solutions, and when might community level interventions be most effective. We also have, I think another one probably current is media use, including social media, and how do we balance both the positive and negative effects of media use on mental health and well-being. Okay, so why does ECHO matter for tribal communities? So many of the national studies in general underrepresent tribal populations, and we saw this in our ECHO cohort here in South Dakota back in around 2020. And so when we identified this gap, we reached out to Missouri Breaks and our colleagues both in Cheyenne River Sioux Tribe and Oglala Sioux Tribe, and we started engaging in conversation of you know, would you guys like to participate in ECHO? We are tribal communities are underrepresented, and we had the opportunity here in South Dakota to bring tribal communities into ECHO and increase that representation on a national level. And the reason why this is important is because ECHO today is used to make national policies. And so we wanted to make sure that all communities were representative, both rural and tribal communities here in South Dakota. And so we found that, or we saw that as our responsibility. And we saw ECHO as an opportunity to change that. And again, just with this representation, both you guys and the communities can make better decisions around interventions and resources and how they're used. So there are several challenges to bringing that we faced. So we currently, Cheyenne River Sioux Tribe, recently came into ECHO last year. We are working with the Oglala Sioux Tribe as well, and in conversation with them to bring them into ECHO. And there are several challenges here. As you can imagine, we heard some great presentations today, both on tribal data sovereignty and the OST Data Committee. And so I'm really excited for kind of where we're going and what ECHO could bring to OST and the OST Data Committee. So the challenge within ECHO is that ECHO requires a centralized data aggregation and uses a standardized protocol across all the national sites. And so this is, as you can imagine, when respecting and co-developing processes around tribal data sovereignty, we have to, ECHO has to be flexible to allow and respect tribal data sovereignty. And so we worked, when we were bringing Cheyenne University Tribe on, we worked for about 2 years. I had conversations with them, worked with Missouri Breaks, worked with the tribe, and really wanted to, we co-created this process of what it would look like to bring Cheyenne University Tribe into ECHO, but also respect that sovereignty. And so what this would look like for OST is implementing the ECHO study while upholding sovereignty. And just to give you guys a sense of the national level, the partnership, I am so sorry. The partnerships that, and the institutions that we've worked with through these processes are Johns Hopkins, Research Triangle Institute, Vanderbilt, Avera Research, Missouri Breaks for Cheyenne River, and the tribe. And so this is just an example of what the process looked like for Cheyenne River. This is an example of what the process looked like for Cheyenne River, and really just showing that this takes time. It is built on trust and relationships, we have already started this in OST. So back in 2020, we were in conversations with the health admin. We received support from the OST HHS committee. Over the last 2 years, we have been holding community meetings to discuss ECHO, to hear what community members are concerned about, what they're excited about, what health, what topics are you guys interested in? And then we also presented to the OST Research Review Board and got feedback on, this isn't your traditional R01 research study. And so how do you want to work, how do you want to see this develop with OST, and how do you want to have these conversations? And so from that discussion back in June of last year, they had come back to us and we asked us to draft a DUA that then we could come back to the Research Review Board and have discussions on, and kind of have a starting point of where to go. And we're excited to actually have that conversation this weekend. So that is what it looks like here in OST so far. We are very excited to see where this can go for OST. I think it's really important, thinking about the data committee. All of the data that is obtained within ECHO comes back to the community and can be used to then better understand what your moms and children's and families look like here on OST, and what are some potential interventions, positive, negative, having solution-oriented, focused work.